Hello everyone, welcome to my channel. Today I'm going to discuss 3 questions related to patient management. So let's begin. The first question is, child suffering with autism comes to dental office for treatment with his brother. How would you start the treatment? So here, let me explain you the situation. So parent comes along with 2 children, all right? So this child is suffering with autism and he has a brother who is not suffering with autism. So as a dentist, now before you start your treatment, you make sure that the child is comfortable. Now, on this dental chair, when you place the patient and suppose you want to do a filling, how would you start the treatment? So the way you start the treatment is by making sure if the child is not being cooperative or is little anxious, which might be common, make sure that the elder brother, the brother stays around the child who is undergoing treatment, because in that way the patient will be more cooperative. So it is tell, show, do technique or modeling. So which one you think is the answer? So these are the 2 options you have. So the option is modeling, because you will make sure that this child will act as a model for so that the patient will have good treatment. So the answer is by making sure that the brother is around the child. Next question. After discussing the patient's living situation with her daughter, a decision is made to report an elder abuse. Which agency would you handle this kind of case? So your patient has come to your clinic and the patient has been coming over 20 years. And then what happens is you find out that by asking questions that the patient's living situation is not really normal and there are bruises on her neck and other parts, and then you come to a conclusion that there is an abuse. Which agency would you call? Would you call Adult Protective Services or Child Protective Services, local police department or nursing department? The answer is Adult Protective Services. Now, as it is not a child, you do not call Child Protective Services and you do not call police, because this is not an emergency situation where the patient is an immediate, like real immediate emergency. If the patient is living in an assisted living, so it would not be a great idea to involve the people over there. It would be rather a best idea to go along with the Adult Protective Services. Now, if a dental assistant mistakenly writes a lesion on 20 instead of A, now what do you think is the principle that is being affected over here? So I have written already the answer. I wanted to write it in the next page, but anyways, so it's non-maleficence, because the principle expresses that the concept that dentists should not do any harm in any way. But here, what is happening because of the dental assistant? Now, if there's no lesion on 20, like if you write that the lesion is on 20 instead of 8, and you end up doing the wrong treatment, then you're doing a lot of harm to the patient, right? So this principle over here includes different points. The first point is education, that dentist is obligated to keep their knowledge and skills up to date so that they learn all the techniques, and it will be like they have to keep up with regular skills. Now, if dentist is not able to do a case, or he thinks that he needs a second opinion, or he thinks like he might need an endodontist help or an oral surgeon help because he sees an abscess and he's not sure about it, he should definitely send the patient for referral or a second opinion. And also, dentist is obligated to protect the welfare of the patients being cared by auxiliary personals. And if you think like a patient, the previous patient has a disease, and then like a blood-borne pathogen disease caused due to blood-borne pathogen, and then you treat another patient and you think that there might have been any exposure, you have to explain the second patient that this there might be a chance of exposure due to whatever reason it is, but it should be explained. And you cannot just abandon the patient if you wish so, without properly ending the treatment and then giving a proper explanation. Also, it is advised not to have personal relationship with the patients, because then it will you cannot do the treatment properly, because your treatment will be impaired. So in case you have enjoyed this video, please do like, share, and subscribe. Thanks for watching.